Hello, everyone. Welcome to the second day of our virtual workshop on Pan-Canadian Health Information Exchange Standards. My name is Linda Bird, and for those of you who don't know me, I'm an adjunct assistant professor at the University of Victoria. I'm also an active health interoperability standards implementer and advocate, particularly in the areas of SNOMED CT and fire. And I'm the instructor for the University of Victoria's HIMF 537 course on Health Information Exchange Standards, which is hosting this 3-day workshop series. So welcome, everyone. But before we get started, let's begin with our territory acknowledgement. We would like to acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. So we had a fantastic workshop day yesterday, focusing on HIE standards, the Canadian Institute of Health Information, and also social determinants of health. And so I'm looking forward to what day 2 has in store for us. We're in the middle of the overall program, and today's focus is on Canada Health Infoway standards and the Pan-Canadian Interoperability Roadmap, which we heard a bit about yesterday, and we're looking forward to hearing more about today. So following the workshop, the students of HIMP 537 will stay online and we'll do some hands-on activities. Today, we'll be learning about mapping between exchange standards, mapping between terminologies, and creating some SNOMED CT value sets for allergies and intolerance data elements using the ECL query language, which I think is fun, and I hope the students do too. And if you're wondering to yourself, how can I join in the fun too and get your hands-on experience to better understand these interoperability standards, you can enroll in the University of Victoria's Certificate in Health Terminology and Interoperability Standards. This is a 1-year part-time program with 4 graduate level courses done weekly through online evening classes, plus this virtual workshop that you're at right now. This is the only terminology standards program in Canada that's accredited with CHIMA, the Canadian College of Health Information Management, to become a certified terminology standards specialist in Canada. If you'd like to join our September 2024 intake, please apply by June the 1st. And to find out more, you can quickly scan the QR code or visit uvic.ca HSD/certificates. But coming back to the workshop agenda, here is today's lineup. We have not 1, but 4 fabulous guest speakers from Canada Health Infoway. And first up, following on from our HIE Standards 101 tutorial yesterday, today Linda, Monico and Anil Patel will be presenting the Infoway Standards 101. So just a bit about Linda and Anil before we get started. Linda and Anil are both senior standards specialists with the Canadian Standards Release Centre at Canada Health Infoway. Linda's background is in business and health information management. She is currently leading the authoring and publishing of biannual releases for the Pan-Canadian LOINC Observation Code database and is a LOINC Laboratory Committee member. Linda also leads the support service for InfoCentral, which is Infoway's interoperability collaboration platform. And then Anil has a laboratory medicine background. He is leading the subsets maintenance and publishing work. Anil is Infoway's HL7 Canada Council representative at HL7 International and the Fire Baseline community. He's also a UCAM advisor and a LOINC committee member for Laboratory LOINC, Clinical LOINC, and the Document Ontology. So with that, I'm very pleased to introduce Linda and Anil. Over to you.
Thank you.
Great. Thanks so much, Linda. Okay, so welcome to the Standards 101 session. Thank you, Linda, for introducing Anil and I, who will be co-presenting today. It's a real pleasure to be a part of this workshop. And I am just trying to find my own presentation as I do this. So we're excited to be here and to cover a couple of exciting topics, we think. The very first one, and we can move to the agenda slide, is, oops, thanks. Okay. So what we intend to cover as part of this session is what Infoway is about, our vision and our mission, the Canadian Standards Release Center service offerings. We'll walk through at a very high level health terminology and data exchange standards. We'll look at the interoperability standards as part of some of the main projects Infoway has implemented or is actively collaborating on. And then we'll provide some of the ways in which you can stay informed and also decide if you'd like to collaborate with us. Next slide. Oh, thank you. So Canada Health Infoway was founded in 2001, and we're coming up on a quarter of a century, so that's exciting. Infoway is an independent, federally funded, not-for-profit organization working to accelerate the development, adoption, and effective use of digital health solutions. Infoway operates under the accountability of deputy health ministers across all levels of government to ensure alignment with national healthcare priorities and objectives. At Infoway, we do believe that a more connected and collaborative system is a healthier system, and we work with governments, healthcare organizations, clinicians, and patients to make healthcare more digital. And so we're working with all of our partners to transform the health system because we know that digital in health can be just as transformative as digital has been in other aspects of our lives, such as banking, as just one example. And so Infoway is driven by the vision of equitable access to exceptional healthcare and health information for all Canadians. And so we can move on to the next slide, please. Thank you. Our mission is to inspire, to inform, and mobilize stakeholders alike in healthcare towards a future where digital health enhances patient experiences. And so by integrating digital health into the healthcare journey, we unlock more efficient and accessible care models, enabling secure information sharing and driving better health outcomes. So just before my colleague Anil walks us through our Canadian Standards Release Center services, we wanted to share how our team is organized and just looking at this organizational chart to show how we're reflected. Our standard team sits within the larger connected care team at Infoway, and we support the entire Canadian Standards portfolio, which is our one-stop shop for all pan-Canadian standards related tools and services. So we have our senior director who oversees the Canadian Standards Release Center, and then we have two managers with distinct areas of responsibilities, one with a focus on SNOMED CT and another with a focus on PCL-OCD and LOINC, and the business and operational side of things as well. And supporting these two managers are a range of specialists, such as Anil and myself, along others, each bringing domain-specific expertise to ensure that we have comprehensive support for all of our standards initiatives. And so with that brief introduction of our team, Anil will delve into the standard services that we offer.
Thank you. Next slide. Okay. So Infoway is the National Release Center for clinical vocabularies, such as SNOMED and PCL-OCD in Canada. We have a host of basket of standards that we support, okay? And Infoway is the affiliate license holder for both HL7 Canada and IHE Canada. We at HL7 Canada also have an affiliate license with IHE, and IHE is just starting up again after some absence. So, please join that group, and there's lots of activities coming up and you get a chance to mold it. We also provide secretariat support for ISO TC 215, which is a community in partnership with the Standards Council of Canada. And Infoway is a voting member of the International DICOM ballots. So we're a member at DICOM Working Group 6, which helps inform Canadian requirements. to the base DICOM standards. IHE provides the capability to electronically move clinical information from different systems and maintain the meaning and information being exchanged. Next slide, please. So these are the direct services that we provide to Canadians. We do standards, content development, licensing and distribution, and SDO affiliates, as we mentioned before. Next slide. The content development that I highlighted before, we get requests through Informs, which is a Jira-based system. It's a ticket management that allows you to submit a request for change, whether it's HL7, PCL/OCD, SNOMED, all of that, and you're able to see it and manage it through the Access portal. Okay. Any RFCs that are submitted, for instance, SNOMED, we have a tool called TermSpace where we can collaboratively author and do translations, which are then sent on to SNOMED International for inclusion in the international version. If you wanted to see, what we're working on in Informed in Jira, we have dashboards, and these dashboards tell you the content and issue and the status of its tracking. In this one, you can see that there are about 2,907, issues in progress. And we also have dashboards for COVID and PCL/OCD. Okay, so InfoCentral is the collaboration hub, as I like to say. Next slide. Okay, licensing. Infoway provides a convenient access to a wide range of licensed and proprietary material. And to ensure compliance with our various agreements, Infoway's account users are asked to reconfirm acceptance of these group agreements every March 31st every year. All the SNOMED CT, LOINC, and Infoway tools are available at no cost to users with an active Infoway account. And there's a subscription and webhooks notification, so you can be aware of anything that's been changed. We also provide OIDs that are free for registration. HL7 membership is typically around 500 if you're an individual member, and an OID would cost you about 500 for a single one. So becoming a member of InfoCentral and joining up has some advantages. Okay, next one. Services that we provide to the communities of practice, we provide education and training like this. Webinars are on a weekly basis. The monthly ones are part of the community groups and communities of practice. We have communications, protocols, and social media postings too. For the HL7 education, we refer our members to the HL7 website where there are discount codes for all of you. So it makes it cheaper, whether it's in person or, a video presentation. We don't at present provide any education for IHE or ISO, but we're hoping for IHE to do something in the near future. Thank you. So on InfoCentral, which is our collaboration hub, this is the one-stop shop that I go to get everything. We have communities that provide an opportunity for people to collaborate and communicate on interoperable topics. So, those are of interest to them and their peers, so you don't have to join them all. They foster open and inclusive participation and encourage diverse perspectives. Communities provide space where you can share news, attend education centers, connect with experts, host meetings, share lessons learned from your own jurisdiction or both. You can find historical information that is relevant to your needs. The working groups, which I really enjoy those working groups, are made up of committed implementers and engaged stakeholders with a broad representation. They're led by a project sponsor, and with a SME and sometimes an Infoway rep to support it. And sometimes they have affiliate facilitators too, and affiliate members. The outputs of these groups will have a direct impact on the ground sort of success to interoperable projects, and they're either immediately available or in the future. For instance, examples of this is the sex and gender work that had been going on for a couple of years. In SNOMED, I think they're looking at organisms now and French translations. A new one that's recently been up for about a year is the social determinants of health. Now, the types of communities that are around are domain specific, such as medication management or enterprise imaging, and they may focus on specific interoperable priorities, such as clinical messaging or secure patient summaries. And they may focus on standards such as HL7 FHIE or the one that I host, health terminologies. And they may be formed by a professional group or a community, such as nurses or physicians or occupational therapists. Okay, next. There's a series of links here that tell you about the educational offerings. SNOMED International has a vast library of free educational offerings, and you can reach them via the link. Regent Street Institute or LOINC has a number of presentations that they have, webinars from previous meetings. HL7 International has, like SNOMED, a wide range of material. We have Infoway's ongoing webinars, so there are webinars every month. I would say there's one happening. Of course, the University of Victoria, CHIMA, and CTSS, credentials. So that's what is available. Next, thank you. Just an overview of some of the activities at 2023 and 2024. If you had last year's slide, you'll see that these numbers are greatly improved. We have over 6,000 updates related to clinical vocabularies, English and French. That's like SNOMED, I think, have been in the thousands. We've also have over 50 Canadian FHIE projects available that are accessed. There's a number that are private still, but over 50 publicly available ones, and you can see those. There's about 140 releases every year. That is SNOMED, the prescribing immunization, and the two PCLOCD ones. And 2,100, engagements related to standards engagement, where we get these questions through our InfoCentral and we answer back to them. So the sort of operational activities that we're doing here are like CT, SNOMED CT editorial guidelines, CT international publications, SNOMED CT Canadian publication, and the annual subset maintenance release, which happens every year. We're going to now make that continuous, so then you'll see that. We do get some requests also for the older code systems like SCP type and SCP qual. Those are still existing, but we get HL7 and subsets. And now we're in the final stages of the HL7 international ballots. Thank you.
Health terminology standards are really the basis of shared meaning between different systems and provide the clinical terminology that enables healthcare providers the ability to communicate and share health information in a consistent, in an ambiguous, safe, and reliable manner within digital health solutions. First up, and this slide here is perfect, we have one of our most successful standards implemented in Canada. And I would say the nearest and dearest to Anil and I, as we both work closely with this standard. So the Pan-Canadian LOINC Observation Code Database is the key lab terminology standard adopted in 9 out of 10 provinces and 1 out of 3 territories across Canada. PCLOCD is a Canadian adaptation of the broader LOINC terminology. It's comprised of LOINC codes tailored for lab use within Canada. It also has Pan-Canadian codes that are unique to PCLOCD, And just a few noteworthy features of this standard are the pan-Canadian attributes that exist both in English and Canadian French, the pan-Canadian component name, which is fit for purpose and being used in the jurisdictional lab viewers, as well as the recommended units of measure for use in Canada that use the UCOM standard, and that's the Unified Code for Units of Measure. Currently, PCLOCD includes a small amount of clinical LOINC codes. However, we are actively looking at expanding its scope to include more document ontology codes in the very near future. So Infoway serves as the release center for PCLOCD, and we provide biannual updates. Our releases are scheduled for the end of March and September. On the next slide, we've got some key highlights from the last PCLOCD release, and it's based on the updates from the International LOINC 2.77 version release, which included approximately 101,633 terms. So we published PCLOCD version 5.20 on March 28th, and this release comprises a total of 39,797 codes. We're now at about 98% of PCLOCD LOINC content being translated into Canadian French, and we continue to provide our translated content for inclusion in the LOINC releases twice a year. Infoway also serves as the standard release center for the Canadian edition of SNOMED-CT. SNOMED-CT is recognized as the most comprehensive multilingual clinical healthcare terminology in the world. And the SNOMED-CT Canadian edition contains content that is specific to Canadian use contexts. Our team maintains and publishes this Canadian edition of SNOMED-CT in English and Canadian French every quarter, and it's scheduled at the end of February, May, August, and November. And so if we take a look at the most recent Canadian edition of SNOMED-CT released in February, there are some notable updates. For the English content, our team received a record-breaking 5,423 requests for change, of which 542 concepts were created and 225 concepts promoted to SNOMED International release. In the French content, our team received another groundbreaking number of 4,449 requests for change, of which 3,593 newly translated concepts were created in this release. So we continue to see an increase in the Canadian French translation of concepts for implementation in Canada. So understanding the uses for standards is really key for grasping the significance and the value of healthcare terminology. So the relevance and importance of healthcare terminology really varies based on the end user's goals. Different healthcare terminology standards serve very specific purposes, and each is generally effective in meeting the objective intended. For instance, LOINC, it serves as the code system for identifying health measurements, observations, and documents. SNOMED-CT is a comprehensive clinical health terminology that enables consistent, processable representation of clinical content in EHRs and also EMRs. CCDD is the drug terminology used in digital health solutions, particularly in e-prescribing within Canada. So when users of standards align their goals with the appropriate standard, they typically find the right terminology to suit their needs. There are a variety of terminologies in use across Canada in various clinical applications, such as LOINC for lab testing, ICD for capturing mortality and morbidity information, CCI for capturing procedures and interventions, and SNOMED-CT for capturing a variety of clinical information from health concerns to the latest immunization administered. So standards, they play a vital role in data capturing, integration, and system communications in healthcare. And we can see here just a few examples of how terminology standards provide the clinical terminology and the communication framework in lab and in other information systems that facilitate seamless interaction and information sharing among healthcare providers. So this ensures that the health information is being communicated consistently, unambiguously, and in a safe and reliable way. Standards are also instrumental in facilitating the sharing of information, particularly in digital health solutions. Standards support a number of functionalities, including the secure exchange of healthcare information throughout the care continuum, such as in labs or drug diagnostic imaging, the implementation of clinical decision support systems, such as the alerts and reminders, synoptic reporting, which becomes especially beneficial in cancer care management, population health management, which aids in screening and public health initiatives, and also in data analytics for performance management and research purposes. The data exchange and messaging standards facilitate the sharing of structured data across different information systems. The HL7 message standard define the structure and the content of the messages that are exchanged between systems in various administrative, financial, and clinical activities in the healthcare industry. So FHIE, as I'm sure everyone has heard of, is the latest standard developed by HL7, and it stands for Fast Healthcare Interoperability Resources. It's comprised of logical building blocks called resources, and they're assembled to create solutions that are intended to solve real-world clinical infrastructure and administrative issues. FHIE has an implementation focus and uses modern web technologies such as HTTP RESTful protocol and modern data exchange formats like JSON to represent data. It's the ideal choice in a wide variety of settings: mobile phone apps, cloud communications, and health record data sharing. FHIE allows developers to create apps that feed information directly into EHR systems and clinical workflows using technologies that they are already familiar with. So what happens when systems support FHIE? Well, doctors are able to access complete patient records instead of isolated documents, and medical devices, as an example from various manufacturers, send data directly to EHRs. So any previously isolated data can now be shared, and data modules are efficiently integrated into the clinical and administrative applications, and this will in turn save time and costs. And so next up, Anil will walk us through what this all means in practice for interoperability.
So many of you may have seen this slide or this representation of standards and interoperability in healthcare. This is the 4-level. There is a 5-level one I've seen, which is a little bit more different, but it adds an extra layer between the semantic and structural. So the effective delivery of care requires interoperability. The seamless flow of information between different solutions and devices. Interoperability enhances continuum of care, collaboration between healthcare providers, patient access to the health information, and it reduces inefficiencies within the healthcare system. Interoperability provides a continuum of care and collaboration between healthcare providers and patient access to their health information. By breaking down these data silos that exist, it also reduces those inefficiencies and redundancies within that healthcare system that you're looking at. There is 2 folds to the interoperability. There's the technical connection and there's the data that's shared. So if you look at it, you can see that there is a foundational level 1, which establishes the interconnectivity required from one system application to communicate securely with another one so that it can receive the data. There's the level 2, which is the structural, which defines the format, syntax, and organization of the data exchanged, including the data field level for interpretation. Okay. There's the semantic, which provides a common underlying models and codification of the data, including the use of data elements within standardized definitions from publicly available value sets and coding vocabularies. And it provides a shared understanding and meaning to the users, where this is where I say, the rubber hits the mat, because this is where you'll be able to see information. And at the highest level, level 4, is organization. This includes governance, policy, social and legal and organizational considerations to facilitate the secure, seamless and timely communication. And it uses the data both within and between organizations, entities and individuals. So these components enable the shared consent, trust and integrated end-to-end user processing workflows. Interoperability refers generally to the ability for health information systems to work together across organizational boundaries and to be able to provide that continuum of care to all. Next. Why does interoperability matter? I always ask myself this. It's the first thing I wake up in the morning, I always think when I'm doing my interoperability. I've got to think about that. So interoperability, imagine that a family physician wants to communicate with a specialist in another practice, but they use 2 different solutions. While some solutions offer secure messaging capabilities, most cannot communicate with all other systems. Instead of collaborating directly, clinicians develop workarounds using outdated technologies like fax machines or, and so interoperability matters because it improves the continuing of care, it's collaboration between healthcare providers and patient access to their health information as it enables the meaning and actionable data to flow through a standardized data content format. It breaks down those data silos that still exist even with our own organization and enables integration and connection to possible seamless data sharing. And essentially, it reduces the inefficiencies and redundancies within the healthcare system. Thank you. So this is the implementation and adoption maturity level that SNOMED CT has as its framework. There are certain characteristics that you can gain insight into the level of maturity and adaptability of standards and implementation specifications. This is the example of the maturity model for SNOMED, right? And it conveys a standard or implementation specification maturity based on its implementation state, okay? So adoption level conveys standards approximate and average adoption levels for the specific interoperability. Each level provides for increased value from the use of SNOMED CT, and this framework can be used to assess the current maturity level of a SNOMED CT implementation, or it could help us to plan for the higher level of maturity, which provides additional benefits to us. It can only be when healthcare organizations implement SNOMED CT at level 3 or above that you can fully realize its full potential. Thank you. This is the standards maturity model for FHIE. Okay, the standards process maturity level conveys a standard for implementation specification maturity. And in terms of stages, there's a particular organization approval or voting process. This is HL7's FHIE example of it. Okay, fire resource maturity model is depicted here, and it evolves around 4 releases since its initial emergence in May of 2012. Okay, it's grown from a true draft standard, STU3, with 49 resources or data modules, to currently it has 145, and it continues to expand. In the time that the standards has improved and changed to meet the needs of health information technology. The draft standard started for trial use 1, which was DSTU1, and draft standard use 2, which was DSTU2. Okay, and there was a draft standard for level 3, which was STU3, and quite a few implementations were based along that, but you know, they're being retired, and I'm not sure if it's backward compatible from the current release, which is release 4 to release 3. So the current release is release 4, and there are 2 key clinical resources, patients and observations, that were released as normative, and it includes 9 additional resources. We're now looking at release 5, you know, R5, which will see an increased normative content with over 30 resources, and it's been nominated by HL7 working groups to be matured to this level. That means that all the resources and data elements have been approved by ANSI. We may actually skip release level 5 and just go to level 6. That's how rapidly this fire standards is moving. Infoway has been involved in the standards development work, and there is a lot of resources involved in this and breaking it down and in the whole ballot process. The journey, thank you. Since its inception in 2001, Infoway has always promoted interoperability. And so it has co-invested with Infoway and the jurisdictions in foundational electronic health record systems. As Linda identified, you know, our lab information system is probably our most successful and mature. There are patient portals out there and electronic medical records that have also had a strong foundation for Canadian interoperability. Increasing use of digital health tools has created a renewed impetus to address key interoperability challenges and to enable better coordination and continuing of care. With better communication, I think, and with collaboration between patients and providers, we can help create a better health outcome for all Canadians and a healthier system overall. Sorry about that. Bit of a dry throat today. Let me tell you about Prescribe It. Prescribe It is Canada's national not-for-profit e-prescribing service. Okay, it provides a safe and more effective medication management. It improves medication safety, so there's less lost prescription, and because it is securely messaged, and it also allows for easy renewals and better control over dispensation, right? So we know what's been dispensed. At the moment, more than 300 communities have gone live with Prescribe It, and more than 3,000 pharmacy sites have enrolled in it, and more than 4,000 prescribers prescribe using it, and it leverages, you know, standards like HL7, UCOM, PCLCD, and SNOMED CTCA. But there's still more work to be done until it's available everywhere in the little mom and pop pharmacies. Next slide, thank you. As Linda identified earlier on, there's a Canadian clinical drug data set. So the clinical systems will use their existing drug terminologies, often a combination of HL7, Health Canada's drug identification number, which is the DIN number, or the national product number, the NPN, or some proprietary terminology like First Data Bank. Vigilance Santé, Cerner's Multiman, or Drug Bank. There's a whole bunch of them that exist, and they're used in existing user interfaces. Some vendors, produce the vendor package and make it available to all for their own use. So the knowledge-based vendors like First Data Bank and Cerner will include mappings between their proprietary codes and also the CCDD and their products, thus enabling the interoperability of medicinal products, names, and descriptions. The interchange terminology that's used is primarily designed to be used inside systems, so it supports the sharing of the meaning when systems communicate between each other. And interchange terminology is often used to provide mappings. So this is a contrast to the interface terminology, which whole purpose is to support clinicians to enter, patient-related information into systems and to facilitate the display of computer-stored patient information, which is simply human-readable text. There are 4 different components to CCDD, which first one is the manufactured product, which is called MP, which is the brand-specific representation of the manufactured drug product in Canada. There's the non-proprietary therapeutic product, which is NTP, which is a brand independent and clinically orientated representation of the manufactured drug product. This is the therapeutic one. There's a therapeutic moiety, which is a functional and clinical specification, and this represents the active ingredient or substance present in the medicinal product. And lastly, there's the device non-proprietary therapeutic product device, which is the clinically orientated healthcare devices like blood monitors and glucometers and things like that. Next, please. There's a deeper dive into patient summary, okay, and that's going to be provided by Alana, and she'll talk more about patient summaries and interoperability today. So I'll leave this for her to talk to. Okay, next, please. We have a data. Thank you. We have a data content data model. The purpose of this is, it defines a patient summary content, but there also addresses some jurisdictional variances. Okay, and I think Alana will be talking about this too. Okay, thank you. Next slide. Recently, we've been involved in meetings with Canadian Institute of Health Information, that's CIHI, and they recently came up with an updated Pan-Canadian Health Data Content Framework model. They intend to publish it in September, and the Pan-Canadian Health Data model defines the health data required to enable connected care across Canada. The first model will be a limited production lease. There are some, but it will provide information that previously wasn't, and it's tied into the HL7 FHIE specification. Next, thank you. So digital health interoperability in Canada. I think Samantha will be providing an update today on the progress to date of the shared Pan-Canadian roadmap. It's got a lot of slides in it, and they're very good. So we'll skip by this one. And coming near to the end of our presentation is, how you can get engaged and stay tuned is to, as I said, go to InfoCentral and sign up. InfoCentral is kept up to date with all our initiatives and collaborations. And by subscribing to it, even our interchange newsletter, you can get involved in and influence and contribute to it. And if you want anything, you can contact us at the email address, and it will be sent on to Linda and I, and we can answer your questions. Next slide. Here are a few quick links from the presentation that I provided. InfoCentral is here. Prescribe it. You can hear all about it. Virtual care settings. There's the organ donation and transplantation program, which I didn't really talk about, but that's now being rolled out across all of the jurisdictions. And they have a vendor that is presently enabling that. Of course, my favorite, the Health Terminologies community, every Tuesday. The link to that, where you can find everything. I think we try to do a bit of everything. And of course, the Terminology Gateway, where you can find T-cell-OCD, SNOMED-CT, and any subsets, and also jurisdictional subsets that are available. That's it. And if you have any questions,